Okay, my name is Isaac, and today we're going to be talking about direct access and its impact on the physical therapy profession. Alright, getting started, just some terms to know. Direct access is when patients directly seek out physical therapy services without the need of physician referral. Physician first access is the exact opposite. You go to a physician first, and then they refer you out to physical therapy with a prescription. Plan of care, POC. PPO is preferred provider organization, POS is point of service, and HMO is a health maintenance organization. These are some topics we're going to get into and cover the insurance part of this PowerPoint. So, the history of direct access, we're just going to do a brief overview here. 1957, Nebraska was the first state to implement any sort of direct access at all. Now, by 2021, all 50 states have implemented some sort of direct access. They all vary by state and insurance plan. In 2013, Indiana permitted direct access with some sort of provisions. So if you look at our map down here, you look at the blue, this is all the unrestricted states and their direct access. The pink is going to be direct access with provisions, and then the red is going to be limited direct access. So like I said, 20 states have no restrictions, 27 have provisions, and 3 have limited. And then the provisions, these can vary from the number of days you can see a patient to the number of visits you can see a patient, or the type of treatments you can perform like spinal nips or EMG needling. Okay, getting into the insurance part of it, we know Medicare is a big player in insurance, so there's no physician order required to initiate treatment. However, their plan of care must be certified by a physician within 30 days of the initial visit. Recertification must occur within 90 days, or if there's a change in the condition. And then you get into the different types of insurance plans. So you have a PPO plan, so this is a list of preferred providers. You can choose inside or outside the list, but if you choose outside the list, you might have higher out-of-pocket costs. The POS plan is the point of service plan, so you're going to pay less for a provider that's in network, but the provider you do choose needs to give you a referral to see therapy or another specialist. And then the HMO plan is the health maintenance organization plan, so you need to choose a primary provider within the network, and then they need to give you a referral out to physical therapy. So looking at the macroeconomic effect, this is kind of like your broad view over the whole system. So if you start here, this is kind of the old view in the blue. So basically you have an injury, you're going to go see your initial doctor. They might send you out to a specialist, who then might send you to imaging, and then you're going to follow up with your doctor before they refer you out to PT. With direct access, you can go straight to PT. They can evaluate you, get their 2 cents of what is going on, and then if they think it's something complicated that may require more imaging or another opinion, then they can refer you back to that physician. But in this case, you can jump right to physical therapy, so that way if it's something they can handle, you're getting the treatment immediately, and you're going to get effective care. So there's been a systematic review done and meta-analysis done by Han et al., and they looked at the effectiveness and outcomes of musculoskeletal disorders between direct access and physician first access, and basically what they found is direct access is going to reduce physical therapy costs by almost $265 per patient. There is a reduced total cost and healthcare expenditure of almost $2,000 per patient, and it's going to reduce the number of visits by about 1 visit per patient if they go to direct access versus physician first access approaches. So on a broad scope, it's going to increase your accessibility to physical therapy just because you can go straight there. One of the studies that were performed in this examined in this meta-analysis was done on U.S. military personnel. So they were actually direct admitted to physical therapy for musculoskeletal disorders, particularly in the low back. And in that treatment, they found basically the physical therapists are very accurate with providing diagnoses and ruling out other conditions. And that the only group that scored higher was orthopedic surgeons. So physical therapists are more than qualified to be a primary care provider. Looking at the microeconomic effect, so this is going to be smaller scale. This is almost like in the clinic itself or the PT themselves. So like I said, you're increasing your access to physical therapy. So if you're having more patients that can come to you, you're probably going to have a higher patient caseload just because they can get that immediate access to care without being bumped around to different providers. So financial planning, how is this going to come into play? If you're having that, you're going to have more direct access. So if your patients are paying out of pocket because they're going to a provider that's not within their network, you may earn extra revenue that way. There's cash-based practices, so you can pay cash-based for some of the services, and then you can earn more revenue that way. The increase in demand, if your PTs are becoming overworked because of the overwhelming amounts of new patients coming in for evaluations, you may have to hire more PTs, and that kind of comes into the management decision making as well, because if you have too much, you're likely to hire a PT versus a PTA, so you can pick up those new patient evaluations. And then, like I said earlier, in that study they found that a direct access approach reduces the amount of visits by 1 per patient, so that does free up a little bit of time. Policy and procedure development, like I said, there's different rules depending on direct access and the insurance company or the state you practice in. So there need to be policies in place depending on where you work. So example, in Indiana, you can be evaluated and treated for 42 calendar days prior to needing physician referral. If you need more than that, you need to go get a referral from the physician. And then they also need physician referral for different treatments like spinal manipulations or needling EMG. So kind of an example of this would be like a Parkview Athletic Rehab. They treat a lot of athletes. So now with direct access, they can go straight to the physical therapist to evaluate their injuries. So like I said, up to 42 days, they can get treated and evaluated. If they're having an injury, that needs to go longer than that. Like I said, you go out and get a referral. But this is just going to increase the caseload. If they're getting too many patients coming in, then they might hire another physical therapist. And like I said, they're going to have new policies and procedures in place to protect those patients and make sure they get adequate care in the amount of time that they're permitted. Okay, so remember the big takeaway points. You have 50 states with some form of direct access, and allows physical therapists to become a primary care provider, so we need to make sure we screen red flags and differential diagnoses. It's going to decrease overall healthcare costs, improve patient access, physical therapy in a timely manner, reduce the number of healthcare provider visits, and allows opportunity for patients to have quicker functional improvement.